We are focused in particular on the needs of children because children are the focal point of a family. And parents who cannot find an open school or daycare center after a disaster may be forced to relocate to a different community when we're calling on them to rebuild the one that was destroyed. Or parents, if they can't find adequate care for children, have to stay home or stay in a relative's home when we actually need them back at work, because these parents are nurses, doctors, teachers, first responders, construction workers that we depend on for the recovery. There are 32.5 million families with children in the United States. 90% of them include a parent who works. In 62% of the households that contain married couples and children, both parents are members of the workforce. If parents can't work after a disaster, the community, as I said, will have no nurses, teachers, first responders, grocery store owners, gas station operators, carpenters, bus drivers, just to name a few, and will make the recovery even that much more difficult. So this is an essential component in this chairman's view of recovery, and I'm pleased to know that I have many people here that share that view with me. The provision of child care and reopening schools are essential elements to the recovery. We understand that child care facilities are both public and private. Some of them are not-for-profit and therefore eligible for FEMA assistance now, but many are privately owned and operated, mostly operating on very slim profit margins, doing good work in the community. Most of the times, at least in my neighborhood where I grew up, daycare centers were run out of the basements or garages of people's homes. If those homes, garages, and basements have been destroyed by a flood, how do we establish new opportunities to get those daycare centers started? I want to show a chart that's on this issue because this has been a major focus of mine. This shows after Hurricane Katrina, Rita, Ike, and Gustav. The blue are the total applications for small business loans for child care centers. So I think you can see there were 327 total applications. There were less than probably a third, 132 that were approved, 120-something were declined, 72 were withdrawn. But as you can see, and when we show the other chart broken down by parish, if you want to show that, it's even more stark. This is just a snapshot of what happened in Louisiana in several metropolitan, well, in the same metropolitan area, but different parishes. Orleans Parish, Jefferson Parish, and St. Bernard. There were 275 daycare centers in Orleans Parish. Then in August of '05 and in June of '09, we had climbed, very difficult climb, back up to only 141. But if you look at St. Bernard Parish, that had 26, a smaller parish, they're just barely back up, to 13. I mean, this is almost, it'll be 5 years this August. 5 years. And again, if we can't find places for children, it's hard to find places for workers since most parents are workers. And that's the main subject of this hearing, or one of the main subjects of this hearing. We can't continue to neglect these facilities and families who rely on them, nor can we continue to underestimate their importance to a full and robust recovery. The other two charts indicate the number of schools. Do we have those charts up? If you see here, you can see the school situation is still, we're really struggling, and we have our superintendent here to talk about this, and although we've made good progress, you can see the difficulty of this recovery. 222 schools post-Katrina. New Orleans now has 154. Jefferson has slightly more. It was a host community, and populations moved there. And then look at St. Bernard Parish, 22 schools, only 11 open today. And of course, St. Tammany Parish, which was a hard-hit parish, but also one that was on the recovery and sort of a host parish to Orleans. We have 3 more schools than we did before. But this is just to show you what the struggle still is. Reopening schools and daycare centers inside the disaster area is critical, but we must also look outside the disaster area and address the needs of displaced families in host communities. Hurricanes Katrina and Rita displaced over 370,000 children along the Gulf Coast, many of whom lost their homes and were unable to return for months. Families had to enroll their children in new schools, new child care centers, new state-run health care programs, in many instances that were extremely challenging. The federal government had several states established ad hoc programs to assist them. We're going to spend some time in this hearing talking about what worked and should some of these programs be made permanent. Children have unique needs that require specialized planning. As our FEMA administrator who's here with us today, Craig Fugate, said, we must ensure that emergency planning accounts for citizens in the community, all citizens, not just able-bodied adults with ample resources. And children are just not small adults. They have special needs, and I agree with him. Finally, let me mention mental health. As the Commission pointed out, children are disproportionately affected by disasters in comparison to adults when it comes to mental health. Children suffer higher rates of depression, post-traumatic stress disorder, and behavioral problems following a disaster. The LSU's Department of Psychiatry screened 12,000 children in schools during the 2005 and 6 school year. 18% of them had a family member who was killed in the storm. 18%. 49%, almost 50% of the children screened met the threshold for mental health referral. And 1 year later, that referral rate was lower, but not that low. It was 30%. So according to some good research that we have reviewed, we know that that is still a great challenge. The greatest barrier to accessing these services are transportation, stigmatization, and financial problems. School-based counseling, and then I will conclude. That same report emphasized an approach to service delivery that I'd like to focus on today, which is a model of school-based counseling. Save the Children and RAND have also commended this approach. Schools that require psychological assessments after a disaster can help remove the stigma when all children are being addressed and spoken to. Placing providers in schools help parents save money on treatment costs and avoiding having to leave work and drive their children to the point of service, particularly when the point of service that they used to drive to no longer exists, which is very important for people to understand. The hospital that was right around the corner is closed. The doctor's office that you used to visit is gone. The doctor has moved to Houston or to Atlanta. It's not the same after a disaster as before getting your children to these points of services which literally no longer exist, particularly after a catastrophic disaster. School counselors also represent an existing workforce that can be trained in advance of a disaster, et cetera, et cetera. So hopefully we will hear some good suggestions about that today. And finally, millions of parents, educators, counselors, social workers, nonprofit innovators, and community leaders work hard every day to improve the lives of children in this nation. Through the continued efforts of the Commission and state and federal partners that are here today, we must provide strategic leadership and resources to move our children out of harm's way before disaster strikes, get them quickly back into school and to a daycare support system that helps their parents get back to work that we depend on to rebuild our communities. We must invest in a smart, strategic, community-based support networks. That's what this hearing is about today. So I'm pleased